Hello, Bursties. Brittany Stewart here, founder of Burst Oral Care. I am so excited for today's Founders Exchange. Joining me is Dr. Dustin Nowaskie. Dr. Dustin is the founder, president, and chief medical officer of Outcare Health. As well, they have an MD in psychiatry. So what we're doing here is we are talking to a serious medical expert. Hello, Dr. Dustin. Welcome.
Hi, thank you for having me today.
So I think for most of our viewers, they are not going to be familiar with what Outcare is. And so I would love for you to share the origin story of Outcare. Who are you guys? What do you do? And why do you do it?
Yeah, absolutely. Great question. Yeah, so I founded Outcare back when I was a medical student. That was back in May of 2015. So we're about to celebrate our ninth birthday, which is really exciting. We are a leading nonprofit organization dedicated to promoting healthcare equity for LGBTQ plus communities worldwide. Our ultimate mission is to empower people with a lot of information, resources, referrals, support, education. We have the largest affirming provider directory in the entire world. We have a mentorship program. We have support groups. We have a webinar series. We do care navigation now, blogs, research, you name it. So there's a lot going on. I'm probably missing a lot. But our ultimate vision is to create a world where every LGBTQ plus person has access to quality and equitable care and also feels empowered to live their healthiest, most authentic life. I started the organization when I joined medicine. I really knew that I wanted to do something outside of traditional medicine, which is, as a prescriber, is often medication, right? Writing prescriptions and getting people access to medication when they need it. And I do find value in that. But when I started medical school and doing a lot of research on my own, I realized pretty quickly that medicine is just a fraction of overall healthcare and well-being. And a lot of recent research shows that social drivers of health, especially, account for much, much more of overall health than medicine does. And really, the percentages anywhere from 80 to 90% of our overall health is related to social drivers of health. And that was very important to me. As an LGBTQ plus person, I knew that there was a lot of stigma and marginalization within healthcare, within social, political contexts as well, because I lived those experiences. And when I got into medical school, I realized actually that my experience was magnified a millionfold across the country and across the world. And so I did a lot of soul searching and finding. At the time, I really didn't know where that frustration, where it could live and where it could be translated into action and passion. And it was really in medical school that I realized that I could carve something out and actually start to impact, my own health, and empower myself, but also communities across the country. And so I was really struck by this fact that LGBTQ plus healthcare disparities are pretty pervasive, and they've been pervasive for decades. And actually, they're not going down. If anything, they're sometimes even increasing for particular identities and people across the world. And that was very meaningful for me. At the same time, I was pretty young. I was engaging in care for the first time for myself, and I could not find a provider that really fit my needs. Also, a provider that I could trust and that I actually knew understood me for me and for my lived experiences and my identities. And so I put all these ideas together, and I started to go out into the communities. I was going to conferences, and I was talking about, my frustrations, but also what I wanted to do in medicine. And I realized very quickly that a lot of people across the country had very similar feelings. And that's kind of where Outcare was born. It was at the time, frustration and really trying to help myself in my own healthcare journey, but then realizing that that was magnified elsewhere, and really pulling these ideas together is where Outcare was born.
I love that. I love this story, to kind of give you context as to why this is so particularly interesting to us here at Burst is we have sort of planted a flag in the ground and said, we're oral care for everybody.
Yeah.
And we, drawing upon deeper conversations that we've had in our company, having equal healthcare doesn't mean same.
Yeah.
And so what we are really lucky is we are surrounded by this community of healthcare professionals, dentists and hygienists specifically, who really want to understand how can they meet the needs of groups. What I have learned in the 7 years that we have been running Burst is that experience for LGBTQ plus individuals is so wildly different than even my own personal experience. I did not understand that there was a gap until I was educated by our healthcare professionals And then it became the mission for us, and specifically around Pride Month, where, where these messages are amplified. What are those barriers? What are the clear education gaps or barriers that you're trying to I guess mitigate or mediate at Outcare?
Yeah, those are great questions. Yeah, before I go into the current gaps and barriers that exist for LGBTQ plus communities, I do like to preface and start with, this foundation of I come from the perspective that I really don't think that that many people in the world are truly malignant. I do, but I also hold the perspective that I think that most people are unaware, right? They don't have the tools, the education, or the lived experience to really understand what people are going through. And so I see this play out all the time, actually, in healthcare and especially healthcare providers. They'll make this very broad, overarching statement that I think comes from a place of authenticity and wanting to truly be a good person and a good provider. They'll say something to the effect of, well, I treat all people the same, right? And I think that's what you're alluding to of, but equity implies that you shouldn't treat all people the same because we are very different people, right? From individual to individual, even if you live in the same community and have the exact same experiences, you still will perceive yourself, the world, and your care in a very different way. And so, these blanket statements of, well, we welcome everyone, I think it's a positive remark, but you actually have to put the action behind it, right? If you do welcome everyone, then you better make sure that you're providing equitable service to everyone at the same time, right? And so,
Well, what we say is, if you're going to welcome everyone, how do you make everyone feel welcome?
yes, exactly. Yeah,
And
yeah,
that's
it's
and
different.
that's different.
Yeah, it is different. Yeah, and and people with marginalized experiences and people who have experienced discrimination and stigma, they know this, right? They don't feel welcomed, right? And when they hear very overarching statements like that, they often have very negative experiences in those type of ecosystems and contexts where they know better, and so they often won't engage in care at all. And so I think there is a disconnect, right, of like industries and companies thinking that they're being welcoming, but on an individual experience, most people look past that, and so but there are, to your question, there are a lot of gaps and barriers, unfortunately. For LGBTQ plus communities and identities, we see that there is a pervasive amount of stigma and marginalization within healthcare context, and so a lot of our research has actually looked at biases and stereotypes from providers and the perpetuation of those that can impact overall care and disparities as well. One of the papers we did a couple of years ago, we actually pulled over 1,700 healthcare professional students who were dental students, medical students, occupational therapy, physical therapy, pharmacy, physician assistant, and social workers. I think I got them all. But we looked at everyone, and we asked these students, how much education have you received, and how much exposure have you had to LGBTQ plus people? And it was pretty upsetting. It was very low across all students, but interestingly, we saw differences. And for dental students specifically, they reported that they were seeing less than one LGBTQ person a year, which is just impossible, right? I mean, how many people does a dentist and a dental student interact with a day? you know, it's
It's statistically improbable, but I've heard this over and over
yeah,
again from them that this is true.
yeah.
And so then it brooks the question, why aren't you going to go see your healthcare providers?
Yeah, yeah, right. And so it's also interesting too because there is a parallel here where the dental community is saying we don't really interact, we don't treat LGBTQ plus people, which we know is false. If you look at the general population, it's probably in the range of 7 to 10, if not more, percent of the U.S. is LGBTQ plus. So by definition, dental providers are seeing an LGBTQ plus person at least one, probably a day, and so
Yeah,
the
the time appointments, you've got one a day that probably is.
yeah.
Just maths,
Yeah,
right?
yeah, right. But they don't perceive it that way because they're not actually talking about identity. They're not asking the important questions. And on the reverse, patients and community members are not feeling comfortable, right, to present that information to their dental providers. But in a parallel, we actually see the education also is very lacking. So in that paper, dental students reported receiving about 1 hour of LGBTQ plus education a year. So not surprisingly, they had the lowest scores in their LGBTQ plus affirmation. So they had the most negative attitudes towards LGBTQ plus people, but they also had some of the least amount of scores of feeling knowledgeable and prepared for LGBTQ plus healthcare.
Wow, wow. So, when you think about these gaps in care,
Yeah.
what what do you think the things that, let's start with showing up to care, showing up to a dentist or a doctor.
Yeah.
What that is an uphill battle for a lot of people in general. And then if you're a part of a marginalized community, multiply that times 10. You know, what has worked for your organization in helping to bridge these gaps?
Yeah, yeah, that's a great question. I think there's a lot of tools and techniques, and you're right. I mean, I do normalize the healthcare experience. It is scary, it's intimidating, it's a system, right? There's a lot of health literacy that you need, a lot of experience that you need to actually navigate this very complex system. I've been in healthcare for 10 years now, and I there are clinics and hospitals that I walk into, and I'm like, not today, not for me, right? Because it's that past experience that I'm drawing on of negativity, discrimination, but then also just being overwhelmed, right, by the physicalness of the location. Sometimes it's stagnant, sometimes it's unwelcoming. What we usually start at is we want to build and we want to instill trust with LGBTQ plus communities and healthcare providers and healthcare systems. But I do think that that's a broad overarching statement, right, of just assuming that an entire system could be affirming. I come from a perspective of, while a system in general can be better on average, I don't know that we can ever make the claim that every single person within a system is affirming. And so you do want to make sure that you're meeting individuals at a local level. And that's what we do with Outcare. We are a national nonprofit. When I started the organization, I told myself very early on that while we grow nationwide, I was not going to make overarching broad statements about every single LGBTQ plus community in the country, because there are subtle differences, but they're also very important. There are many differences across local communities for LGBTQ plus people. And so because of that, I purposely set up the organization so that we are structured by state specific teams. So while we have a national presence, we have hundreds of volunteers across the country that will give us input and perspective on what is going in their local community, right? So, like, what is going on in that hospital system or this health insurer, this plan, so that we're working more one on one and we're providing this comprehensive, holistic experience so that we're in the system itself. Tools and techniques go so far, but you actually have to meet people where they're at. And so for Outcare, we prioritize hearing and engaging with people one on one, hearing their stories, their perspectives, and meeting people, everyone where they're at, whether it's leadership, it's a provider, it's someone that's doing the billing, someone that's a greeter. We want to meet everyone where they're at so that we're understanding what has been their experience, what are their assumptions, what are their biases. We all have them, but how can we rectify that on an individual level rather than just providing these one and done trainings or education that feels like a catch-all that really doesn't amount to much.
Right. So if you think about the majority of my audience is going to be the sort of individual healthcare provider, the individual hygienist number one, the dentist
Yeah.
number two. The big thing that they have all shared with me is that I want to do an excellent job.
Yeah.
I feel that the resources available to me are quite limited
Yeah.
in terms of training.
Yeah.
So as you think about things for somebody who is not only well intentioned but has the plans to follow through and be well actioned, you know, what advice would you give them, whether it's here's great ways to frame an individual experience or here's some tools and resources outside of what's available to you to train yourself? I think that's a gap we've seen is, well, what do I do or where can I get this information?
Yeah, those are great questions. And I think every provider struggles with this, right? I mean, I do as well. I mean, there are things where I'm like, yeah, I don't know much about that. And then I'm like, where do I go? And then I usually can't find it out, right? So what happens when you don't know where to go? Kind of forget about it, right? You just move on because we're busy as providers. We were, seeing patients every single day, often on the weekends sometimes or after hours. And so if it's not at our fingertips, we have to move on. We can't spend hours trying to find a resource that may or may not exist. For Outcare, we want to meet that gap, and so we provide a lot of education and training for healthcare and non-healthcare industries. We train a lot of people in the foundations, right? So the communication, the language, the identity, the trends, the shifts, all of that for LGBTQ plus communities. But then we'll work our way up to provide more advanced topics, whether it's condition specific, medicine specific, or it has to do with like a particular topic in healthcare. So we do provide a lot of training. We've done this in a lot of different iterations. We do live training, we do in-person training. We are very well known for our on-demand module. We have 27 modules actually now in LGBTQ plus education. So we work with a lot of individual providers, a lot of students, learners, but then we also work with the systems. But what I found early on, and this is also what providers will mention and what they struggle with the most, is that learning particular topics or facts only goes so far, right? And so you can get presented as much education on slides as you want, but to implement that, right, to actually translate that into your own practice, it takes time, it takes experience, it also takes a lot of vulnerability and flexibility to mess up. So, I'm very vulnerable with people and talking about my own experiences. I've been out for a long time. I've been in healthcare now for 10 years. And I will probably say something or mess up within the next 24 hours. And so, it happens, right? We're human. And we have to be able to tap into that experience and be able to admit our faults and also be vulnerable. And so that this is a lifelong process.
I do feel like there's this feeling, and I think this is a universal feeling for all humans. If you are not part of a community,
Yeah.
you are so hesitant to get it wrong.
Yeah. Yeah.
You are so hesitant to F up, And so when we talk about meeting people where they are, and having this connection, this has been the burst sort of ethos. So we have 40,000 ambassadors. They are all over this country. They are every walk of life.
Mm-hmm.
And it has been the core belief that we believe that people are innately good, especially healthcare providers. We just think it's a profession that if you're doing it, there's something inside of you that wants to help others.
Yeah.
No one goes into this for the
No.
they just don't. So when you talk about like how you guys think about how do you get vulnerability? How do you build that trust in the one-on-one connections? I'm super curious to know what you feel like has made you successful in being able to do that.
I mean, a lot of things come top of mind. Something when you were bringing up some of the community building and like the providers about not wanting to do the wrong thing. I see this a lot. I see this for all providers, right? Whether they're LGBTQ plus identifying or they're cis heterosexual identifying providers. I think it's in our nature to like want to have the right answers, right? Because that's how we're trained. But then you get into the workforce of the world and you realize no one is textbook anymore, right? So we never have the right answers, but we make it work. And so it's interesting that we don't translate that into like people and their identities. And so being vulnerable does go a long way. I often hear, especially from cis heterosexual providers, they'll make comments like, well, I don't want to offend anyone. I don't want them to feel uncomfortable by asking them about their identities. And I have to remind people, actually, it's a very empowering thing to talk about identities, right? LGBTQ plus people love talking about their identities if they feel comfortable to do so. It's the issue that they don't feel comfortable, and that's why they're hesitant. That's why they're anxious. That's why they feel invalidated. But if you can create that very welcoming experience, then most LGBTQ people are going to love to tell you about their identities. And if anything, they'll probably talk about it for like 5 or 10 minutes because they feel very comfortable with you if you bring it up. In terms of like the actual physical location, you do want it to be warming, inviting as much as possible. Things like rainbow flags go a long way, but I do remind people that iconography is very important. It's a symbol for us, but it should not be a catch-all, right? Just because you have a rainbow flag does not mean that you are affirming. It means that you understand that this is important for LGBTQ people, but you actually need to put the work and the action behind it, right? So if you have the rainbow flag, you better be able to tell someone, well, all of our staff has had training, or we employ LGBTQ plus people and we get their perspectives, right? There needs to be a little bit more than the rainbow flag. And so there has been this corporate dialogue too, just to go a little bit in tandem about, corporate America has really talked about rainbow washing, right? And you see a lot of corporations where historically they would change their logos during Pride and put some rainbows either in behind or like within the context of the icon that they already had. And then all this dialogue came out of like, oh, you're rainbow washing because you're not doing too much for the community. So now I'm seeing corporations actually not even putting rainbow at all. And the rainbow isn't the problem. It's the action behind it, right? And so if you dude, we love the rainbow. Put the rainbow on your description or your design. It doesn't matter. But then actually tell us, are you supporting the community, and in what ways are you supporting the community? So building community goes a long way. But yeah, I would say also getting LGBTQ plus perspectives goes very, very far. The workforce historically has not employed people with marginalized identities, especially LGBTQ plus people. So actually bringing people to the table, interacting in your local community, right? So if you're a provider with a local private practice, or you work in a smaller clinic or hospital system, going to Pride events, going to events outside of Pride throughout the year, understanding the lived experience in the local community and building that trust goes a very long way.
I think another thing that we think about over here at Burst is when we're not certain, when we're delving into an issue, whether it's disparity in care for Black America, for LGBTQ plus veterans, we always try to invite somebody from that community
Yeah.
to be a part of that brainstorm. Like, are we getting this right
Yeah.
if we're not a part of that community? I think that's just like another really simple one for us, where it's like, well, I actually don't know a thing about what it means to be a veteran,
Yeah.
so maybe I should have a veteran in this brainstorm as we
Yeah.
talk about what we're going to do to support. I think there's a different, a tenor where just like these nuances. Like, have you invited somebody from the community to be a part of the decision making process?
Right, exactly. And there are a lot of nuances, and with that too, I think we absolutely should be elevating individual experiences as much as we can. But we also have to keep in mind too that from individual to individual, the experience can be vastly different, right? And so sometimes I find that some organizations will unfortunately tokenize, right? They'll tokenize an employee who's LGBTQ plus, or someone down the road in a local community that is running a group. They'll bring them in, and often there can be tension and conflict, right? Because the lived experiences are so drastically different. And so I do remind people, elevate individual voices, but also tap into like nonprofits as well, right? That have many, many people, groups of people that have lived experience that can assimilate all these complexities to say, okay, this is actually culturally how LGBTQ plus people experience this. And really using an individual experience to magnify that to the group at large can be very powerful.
I think that is so smart for you to say such a thing, right? It's sort of like this balance of how do you encapsulate, first of all, I mean, LGBTQ plus is just such a broad umbrella. And then within that, the experiences are so vast. And I think that that's so important. It's like, you couldn't possibly on your own navigate this. And I think the nonprofits will help you so much. And then I think for us as well, what we try to think about is, how do you create impact, right? How do you avoid being just a virtue signaler? Like,
Yeah.
oh, we believe in good things. Well, like, do you also do good things? And so I think that that's another hurdle that people are really understanding, that there's a difference between those two things.
Oh yeah, yeah, definitely. Yeah,
So
definitely. Yeah, getting, and I think you're getting at this idea too of like what is ideal and what is realistic, right? For people. And the reason why there's a difference is because there's barriers, there's gaps, and they are also under the context of a system, right? So if you think about healthcare, one-on-one interactions with providers go so far, right? There's also the system itself. There's also the health plan, the insurance, the coverage, the interactions with allied staff, right? There's all these components where you can't isolate it to just provider, which is why providers often feel overwhelmed and overburdened, because they're like, I hear you. I understand that these are challenging topics and conversations to have, but I'm also limited. Therefore, I need my employer, I need the system to also be in line with the motivation and the longitudinal journey that I'm going on.
yeah, I think 100%. And in our world, like, we would love to see more resources
Yeah.
at an institutional level as well. And I think that's something we're really advocating for. All great change, right, is grassroots and from the top, and to get to your outcome. As you think about your sort of journey, I want to talk a little bit about leadership here, right?
Yeah.
So in these founders exchanges, we talk about people who have had a vision and brought it to life. What have you learned about yourself as a leader, and what ways have you grown building this organization, which is very different than being a one-on-one provider.
I really, really prioritized identity first and community first when I started to build out in the beginning what was a very academic professional exercise. I mean, I don't know that I have copies of our documents, but if you look back in 2015, it was very heavy academic wording and, this model, that model. And then as we got into the community, and this is the joy about, actually really putting your words to action, we would go into the community and say, like, does this resonate? And most people would be like, I don't even know what this means, right? And so they're like, I have disparity, I have negative experiences, and I think that's what you're saying, but the words don't mean the same to me. So I had to really take a step back from academia, even though I was still in there learning, to really blend the community perspective and where people are at in healthcare versus what academia thinks healthcare is. And so that was pretty challenging for me. But I also grew very quickly where, I do think over time I started to really appreciate this perspective that our identities are the most important quality, and should always be centerfold of whatever is being discussed. So socially, right, in relationships, in healthcare, the world, I think that if we can be more vulnerable with ourselves and actually prioritize identity, we'll understand people a little bit more than what we do as a society now. But I think you also mentioned this balance, right, of like balancing individuality for individuals and who they are, but also being able to institute progress on a national scale for communities at large. It's very challenging. And that challenge is still something I'm consciously working on. It takes a lot of time, but outside of that, it takes more patience and actually active listening and being flexible to change over time, but also being vulnerable with yourself and with people is always top of mind and qualities that I'm continuously working on.
I think it's so smart. And, I feel like something that I have said to people before. So for listeners who like may not quite understand what we're talking about in this care gap, the example I've given to people is that, have you ever gone to a doctor or a dentist and told them things and then they didn't listen to you?
Yeah.
And then how did you feel for the rest of that appointment? And then were you honest with them? And do you think that was a successful appointment? For me personally, it was around, I remember when I was pregnant, it was like the first time. I'm used to being listened to, right? I'm founder of a company. I'm like a very empowered person. And it's like the first time I had ever experienced somebody being like disregarding what I'm saying,
Yeah.
on the basis of the fact that, oh, she's just pregnant. This is what pregnant women do, right? And I was right, just for the record. And I went and talked to somebody else. And the thing that I was concerned about was absolutely a concern. This is the gap we're talking about. This feeling of I'm being seen, felt, and heard and listened to is I think really important. And because I do think for people who are not part of marginalized communities, they don't even understand what we're talking, like on the deepest level, they may not even understand what we're talking about.
Yeah, yeah. No, it's true. And it's interesting that you bring that up because some of the data and research that we've done recently over the past year or so, we're pretty good partners with Health Grades. And so we did a national LGBTQ plus landscape survey last year, and we looked at the experiences of LGBTQ plus people if they have experienced medical trauma and gaslighting. And we actually saw very high rates. So astronomically higher rates of gaslighting and physical, sexual, and emotional trauma from healthcare providers, way more than cis heterosexual patients. And so it's interesting that you bring that up because, we all have our own perspectives, right? We have our own biases, we have our own lived experience. And sometimes that does unfortunately lead to barriers of care. It leads to assumptions, it leads to actually not understanding people for who they are and their identities and their lived experience. And so I'm pretty vocal that I am, this has taken me a very long time and I'm still trying to craft this and figure out the balance of what I feel comfortable with versus what a patient would feel comfortable hearing. But I'm pretty vulnerable. I will talk to my LGBTQ plus patients if they bring up experiences of stigma, marginalization, something negative or traumatic that has happened. If I've had a similar lived experience, I will actually tell them that, and that was not historically how healthcare was run. I didn't finish medical school that long ago, and it was very a staunch where it was like, you do not talk about yourself, you deliver the facts, you deliver the care, and you move on, right? And as I went through school, I was like, that's not me. I'm not going to do this like day-to-day job. It feels robotic, it doesn't feel authentic. And so I do open myself up, and I do talk about my experiences for patients because I think that's a lot more meaningful. It builds rapport, but it helps them feel more comfortable.
I love that. And I think we all want a little bit more of that. And again, not to be so like sycophantic to the birth ambassadors, it's the thing that has drawn me to them the most
Yeah.
is that, I kind of grew up in this environment where like you should never be vulnerable for 1 second if you're going to be successful. And these women, and it is primarily women, these women are vulnerable every second of every day in our community. And it's really changed my life. I think I'm a better person because I've experienced that vulnerability and now I know how to give it now in a way I didn't know how to do that 7 years ago. It's like just be as like stalwart and as intimidating as possible at all times and like then no one will ever defeat you, like never be vulnerable.
Yeah.
Okay, so Dustin, something we've really seen here, and it is the reason we're successful, I would say, is we were like, okay, what has gone wrong in dentistry? And what's gone wrong is people stopped talking to the dentists and hygienists. And so we saw this as this opportunity to build something incredible by listening to the actual individual that you spend your time with when you're receiving your health care.
Yeah.
Do you find the same is true on the level of what you all are dealing with, which is that you're not getting the feedback loop from the providers, you're getting them from an insurance company, a hospital group who maybe aren't talking to their individual care providers. Is that true for you as well?
Oh yeah, yeah. I mean, I think this pans out in a lot of different industries, but especially for marginalized communities and LGBTQ plus communities, especially. Yeah, I mean, we see this play out all the time, right? Where when we're talking about increasing affirmation and equity, it often does fall on individual providers, which makes sense, right? I mean, providers are often the ones, their first point of care, they're often the ones who are interacting with patients, community members the most, right? In a very vulnerable personal situation, experiences. That makes sense. But I mean, I also want to kind of challenge that idea to say, yes, providers, these one on one experiences are very valuable and important, but I don't know that we can assume that a 20, 30, even 60-minute visit, whatever we're discussing, can then send someone on their way and have dramatically improved health outcomes, right? I mean, if that were the case, I think we would be a disparity as we are in the healthcare systems. And so it's a piece of it, and that's very important. But I remind people that when we talk about healthcare and the healthcare journey, it is very longitudinal across many contexts. And so I guess I can set it up in this situation. Usually people talk about individual provider one-on-one visits. Sure, that's fine, but that's somewhere in the middle of the entire journey. So a typical journey is someone leaves where they live, their residence, wherever they're at, their community of lived experience. They then go into adjacent communities of lived experience that may parallel or may not be the exact same or at all of their lived experience. Then they have to go into a system. So they have to park, they have to see a physical location, they have to walk through. Then they interact with all of these touch points that are very valuable, but we as a system often don't prioritize. So, for instance, people who are greeters, people who are at the front desk, people that are doing the check in, people at the elevator. Then they get to the actual clinic, they do the check in, they see healthcare staff, they see the provider. Again, a very small fraction of this entire journey. And then you do the reciprocal, right? Then they leave and they go through all of those touch points again. And what I find is that whenever decisions are being made or bringing people to the table, it often is leadership who then brings in DE and I or some type of equity external force. And it's often one or two perspectives, but they're missing this entire journey, right? Of why don't we actually bring in all of these touch points to the table to say, whenever this situation happened, could the greeter have intervened? Could the person at the front desk intervene? Where was the stigma? Where was the marginalization? Sometimes it's the provider. It could have been rectified by the provider, but majority of the time it's actually not. And so we're missing that whole perspective of we need to bring everyone at the table. We should not be doing this in isolation. We should not be allowing leadership or an entire department to say we know best when we actually are not incorporating all of these experiences under one.
I feel so moved by this analogy. Like what it reminds me of is that like if you've ever traveled anywhere you never been before,
Yeah.
and every bit of the journey was fraught, and by the
Yeah.
time you got like, you flew to Morocco, there
Yeah.
was a problem checking in, there was a problem on the airplane, they lost your
Yeah.
luggage, you couldn't get
Yeah.
a taxi. By the time you got to the thing that you were going to be doing, you're exhausted.
Yeah.
You're defeated.
Yeah.
You know what I mean? I that like that's like the analogy that like rung in my head. I'm like, you're right. For some people, by the time they even get to this moment, it's like, well, damn,
Yeah.
like
Yeah. Yeah.
I don't feel good.
Yeah.
And I think everyone who's and I think again, I always try and draw the empathy line to anybody who's never experienced this personally. It's like you've experienced something like this.
Yeah.
And if you've ever been somewhere where every step of the way was uncomfortable, by the time you get to the thing you were doing, you don't feel good.
Yeah. Yeah.
You don't feel good at all. You don't like Morocco,
Yeah.
like,
Yeah.
and it may be Morocco's just fine. It was
Yeah.
everything leading up to Morocco that was no good for you.
Yeah.
I love this. Okay, so we're running out of time here. So remember, majority of the people watching this are going to be healthcare providers, and then there will be a subset of people who, because it's you, will identify as a member of the LGBTQ plus community. Where can people learn more about Outcare Health? Where can they get more involved here?
Yeah, absolutely. So everything we do is publicly accessible, public visible on purpose. I did not ever want to perpetuate the gatekeeping, right, that LGBTQ plus people experience every single day across this country. So everything that we do, all of our community programming, it's free, it's publicly accessible. And then the way that we interact with providers, especially, we want to meet them where they're at, just like everyone else. And so all that information is on our website. So anyone who ever wants to engage with anything, in terms of our community programming, whether it's our webinar, our support groups, our mentorship program, our education training, all that information is on our website at outcarehealth.org. And like I said, we are composed of many, many beautiful, diverse identities across the world. So if you're ever interested to volunteer or to support the organization in many ways, all that information is on the website. We would love to have you. We are a very fastly growing organization. And I'm very vocal that while I founded the organization, I'm a very small fraction of its progress. The progress is really incorporating all these beautiful identities and perspectives that have really shaped this organization to feel like a community and to feel like the Outcare family. So if you are not currently engaging with us, please reach out to us. We're a very welcoming, accepting group, and we'd love to hear your perspectives as well.
Thank you so much, Dr. Dustin.
Thank you.